it to go over there. Nope, not yet. Oh, we're live. Okay. Hi, Dr. Vlad. Hi, everyone. Good evening, good day to you, depending on when and where you're watching this live. This is Dr. LaBinton. I help patients live long and well because I believe the quality of life is just as important as the quantity of life. Sorry, I'm excited, a little frazzled, bear with me. But I'm really excited today to have on our guest, Dr. Vladimir Barayev. Did I say that right?
Yeah, that's as close as I'm going to get. That's all good for me. I love it.
Okay, how do you say it? How do you say it?
I tell everybody to please call me Dr. Vlad. It's like the smoothest, easiest way to come out.
Dr. Vlad.
Dr. Vlad.
Well, welcome, Dr. Vlad. Thank you so much for coming on here. And our guests are in for a treat. This is going to be powerful. We're talking autism. We're talking what to do, how to maneuver, how to thrive, even caring for someone who has this condition because there are ways, right, Dr. Vlad?
Absolutely. Absolutely. Fun fact, the name Vladimir is the combination of two Russian words. Vlade meaning the owner or the ruler, and Mir is the Russian word for the world, so it means the ruler of the world. That's why it's a popular name over there in
okay. Awesome. Well, thank you so much for coming. Those of you who are watching live, hashtag live, you know what to do. Those replay, hashtag replay. You have a friend, you know someone who could use this conversation, please tag them, share them, just forward them, using the arrow thing somewhere on the screen so they can watch it with you. Now, Doc, can you introduce yourself? But first, I have to say I'm a big fan of yours. You're amusing to watch. And I met you in person. You're really, really cool. So I'm honored to have you here. You're a pediatrician. You specialize in autism and ADHD too, and other things, but it seems those are the two. Am I correct in saying that?
Yes, 100%.
Yes. All right. So, Doc, can you introduce yourself? Who are you? What do you do? And why do you do the things that you do?
First of all, I would be remiss if I didn't say thank you so much for having me on as a guest on your fantabulous and amazing platform. It is an honor and a privilege to be here because I have met you in person, and it was one of the greatest moments of my life, I must say. Your energy, you vibrate with a vibrational frequency that the best quantum physicists cannot calculate your exact frequency because you are so far off the charts. My name is Dr. Vlad. I am a general pediatrician in New York City, and I live here with my family on Staten Island, and I specialize in working with children with autism and helping navigate the road of autism, because there are many challenges and unique situations that come up for families throughout the lifespan, where it starts out with early intervention when they're infants and preschool age. Then we have to talk about navigating the educational system. And then we have to talk about navigating vocational and family health and additional care for them as they age into adults and transitioning them into adulthood. So there is an entire kit and caboodle that comes with working with beautiful families and children with autism.
Why do you do what you do? Why did you niche down?
That is an excellent question. I saw a need. And bottom line, there are many. New York City is has been blessed with the number of pediatricians, pediatric nurse practitioners, and generally people that take care of children at every corner of the city that you go to. There's no shortage in our parts. However, those that understand and can help guide families navigate the system when their child is diagnosed with autism, to obtain a diagnosis of autism, even when in this well-resourced, one of the richest cities on the planet, there could be a waiting list of 12 months, 18 months. And during that whole time, children are not gaining skills. They're not getting therapies or services. They're just continuing to really struggle during that time. So I saw that there was a need in my community, and I wanted to make an impact and serve children on the autism spectrum.
I love it, and I'm glad that you're that you found your calling. I think one of many. I'm just putting it out there. One of many, and I'm happy for the people who will use your services, because one of the things I've, in my knowledge of autism, the sooner it's addressed and these resources are connecting mom, parents, and child to the needed resources, there's an increased chance of better quality of life. So both for parents and the child. So let's talk definitions. What is autism, doc, and how does it typically present in children for someone who's watching?
The definition of autism is a neurodevelopmental disorder which presents early on in life. It starts out before a child is at the age of 3. That's when the symptoms can begin. And it is a condition that causes kids, adults, difficulties with social communication, like understanding social cues, having appropriate language skills, and having back and forth conversation, as well as rigidity, wanting things to be done a certain way, and having excessive amounts of tantrums and difficulty transitioning from one activity to another, or changing their typical routines, like school is closed for holiday, can cause them a massive meltdown because it's not part of their typical routine that they're used to, as well as the stereotypies that come along with autism, things like toe walking, hand flapping, echolalia, repetitive speech. One thing that most families are seeing these days in particular is that they'll have a lot of kids with their iPhones or iPads, and they'll go open up YouTube and they'll replay the same, like there's a 2-minute video clip, they replay the same 3 seconds of that clip over and over, hearing a particular sound that they like, and that's their form of self-stimulation. The symptoms that we see in autism vary throughout the lifespan. So you start out with the very young infants before 12 months of age. Some of the early warning signs that they may be at increased risk for autism include not really responding to their name being called by the age of 6 months, having really poor eye contact in that early first 6-month period of their life. Also, not developing or later on developing the ability to babble. Typically, we see babbling show up at around 6 months of age. If a child is 12 months old, not really babbling yet, that can be cause for concern. And not seeking or not having reciprocal games with their caregivers. So, like we look in our baby's eyes and we say, we hear them make a noise, and then we say the noise back to them, and they repeat it back to us as if they're having a conversation. The more affected infants with autism may lack that skill. Now, all of these signs that I'm mentioning, all of those may be absent, and someone may still be on the autism spectrum. What determines how early the signs symptoms will show up will be, one, the severity, and two, the cognitive skill level of that individual on the autism spectrum. So autism grossly breaks down into 3 categories of people who have below average IQ levels and cognitive capabilities, average 85 to 115 cognitive capabilities, and above average cognitive. So you divide up all the individuals on the spectrum into those 3 groups, and that's the distribution in population. So those who have lower cognitive capabilities can have more severe forms, not always, but can have more severe forms of autism present early on in life. Then, when it's usually picked up is not during that infancy period. Autism is usually picked up between the age of 1 and 2. This is around the time that when we have increased social demands on kids, we expect them that when we point to a bird in the sky or a duck, that they will be able to follow where we're pointing and look that way. That's a skill that we expect. That is something called joint attention, and that is something that children with autism lack. 12 to 15 months old, they're not showing joint attention. Then their ability to point and use gestures is another thing that is lacking in many children with autism. So when a child sees something interesting, they'll or they want something from us, like, "Mommy, give me that cookie," and they'll point to the cookie, or, "Mommy, look at that bird up in the sky." Kids with autism don't point. You expect them to have pointing to show things by the age of 12 months, and pointing to ask for things by the age of 12 months, and pointing to show things by the age of 15 months, and they're not meeting these milestones. We get concerned for autism diagnosis, and then preferring to play alone and not really wanting to interact with peers their age. Now, preschool age kids, many of them do parallel play. They'll just play side by side with it.
Mhm.
They don't necessarily always interact. But if they're already turning 2 and 3 years old, they're not really playing any kind of interactive games, playing pretend games like brushing a doll's hair or feeding a doll, we get concerned for autism in those cases as well. So sometimes the signs can be very subtle. Sometimes they can be very dramatic. So like
Mm, mm,
obvious, persistent, and consistent echolally and scripting. So if you and I are talking, the last word of my sentence, a child will just repeat sentence, sentence, sentence as echolally. That's an example. Or they'll do scripting. These days, in particular, one of the favorite producers of movies for children on the autism spectrum is Disney. There are many songs in Disney and many lines and scripts in Disney. And you hear these children out of context, without being prompted, just recite lines from their favorite Disney movie out of the blue. That's a very common finding that we see in autism. And what I mentioned before, hand flapping, toe walking. In girls, we are noticing that autism presents very differently than it can in boys, which is why there's such a discrepancy. There's like a 4-to-1 ratio of 4 times more boys than girls are being diagnosed who have the less severe forms of autism. And that's because what we look for in girls is actually different than what we look for in boys. Girls can still not necessarily be loners or play in isolation. In girls, they may be more social with autism. They can be more outgoing, more chatty, so they may not have the same speech delays that a child with autism would have. But a lot of their communication is out of context. So the things that they're saying may not apply to the conversation that other people are having in the group, or they're not understanding the subtle social cues that are being brought up, like things like humor and sarcasm are difficult for them to understand. So a lot of girls, one of the sayings in the autism community is that before a girl will get diagnosed with autism, particularly if they're on a lower severity of autism, they'll be diagnosed with obsessive compulsive disorder or depression, anxiety, before they get diagnosed with autism, because not being understood by your peers, by your parents, because you are neurodivergent, cause them to have a lot of mental anguish.
Wow. Wow. Good to note. Good to know. So, we're talking let's talk strategies for the parent who's watching, who's like, I see the things, I think maybe because we speak 2 languages in the home, so maybe that's why they're not speaking well. Maybe that's a challenge, and I don't want to label my child, so I think it's more that. So maybe we'll focus. Could you speak to the need for, getting diagnosed, or at least getting screened, to get help sooner than later, and also the fear of labeling when it comes to this diagnosis?
Absolutely. This is very understandable. Because of the stigma that comes along with the diagnosis of autism, many people don't see it as the spectrum that it really is. You have people who have milder forms of autism, particularly as they got older and have accomplished so much in life. They're still on the autism spectrum. I'm thinking of people like Albert Einstein, Elon Musk, and Temple Grandin.
Elon Musk, really?
The leaders of their fields and the leaders of their industries, who are using their gifts of autism that help them to focus in on a single topic for longer periods of time than a neurotypical person would, at the cost of having as much social skill as the neurotypical individuals may, all the way to the extremes of people who live in group residential facilities because they have difficulty remaining in the community because of just how severely they have been affected by autism. Parents only focusing on the more severe forms, and they don't see the full spectrum of autism, and they're not so understandably there's a lot of fear that comes with not wanting your child labeled or not wanting to be part of a community where there can be some more severe challenges with it. So one thing that I remind them is that when a child is young and there are concerns about their development, please speak with their pediatrician, their primary caregiver, to screen them for autism. And if you are unsatisfied with how thoroughly they were screened, seek a second opinion, because by over screening, and you're not a child not having autism, that's not going to cause them any harm. But by not being vigilant enough and not picking up autism early on, you will rob them of the opportunity to have intervention targeted early on in their life, when we know, based off of research, based off of data, based off of experience, getting that intervention early in life gives them the best chance for success in life, lets them meet their potential as closely as humanly possible because they were intervened on early. So one statistic that I share with families is, you have a child, if they get a diagnosis by the age of 3 and they receive intensive behavioral therapies, by the age of 5, roughly 30% of those children can be no longer clinically on the autism spectrum. Clinically on the autism spectrum. That doesn't mean they don't have autism anymore. But there's in my eyes, there's two types of ways that you can define autism: by the clinical definition of meeting certain criteria, and then by what it actually means to be an autistic person and seeing the world from a different point of view, even if you don't have those same repetitive behavior challenges, even if you don't have those same speech and communication challenges, you still have autism and you view the world differently. I'll give you one example. Temple Grandin, when she would hear words, she would visually make images in her mind because of her autism. She talks about this at length in her books, how she was a very visual thinker. So she used that to create patents in the field of animal husbandry, to become a leader in her field of animal husbandry, to publish research articles in her field because of her autism. It let her leapfrog over her contemporaries who were neurotypical, who couldn't visualize creating machinery or engineering devices that she could do because of her autism, even though the challenge of her autism, she was able to overcome them more and more as she grew older and older.
I'm so gladdened. I'm so, there's hope. There's hope, but we've got to find help early. And I have someone who's asking here. Thank you, Art at Dermatologist. Oh,
hey,
see you.
Our friend.
Yeah, so she says, so gaining knowledge can help them know how to best work with with them emotionally and in school. So I want us to speak more to what getting screened early and getting diagnosed on time and what access that gives and how that ties to helping them in school, the children in school, and emotionally. Doc, let's talk about that so people are encouraged.
Yeah,
Yes.
this is a critical point. This is probably the most important thing I'm going to say all night. Getting a child help early can help them build the confidence that they are able to engage in social interactions. We are not creatures that want to be alone. People with autism don't want to be by themselves. It's just that they often have more challenges socially engaging with others, that they find themselves ending up being more comfortable being alone at the end of the day, but they have that desire, that want, that need to be embraced by other people in their community, by their family and friends. So helping a child build that confidence and build that comfort early on will lower their risk of developing emotional disturbances later on in life, depression, anxiety, and then to help them understand themselves better. They do not get access to resources unless they have a diagnosis. Now, early on in life, in the first 3 years, the early intervention program, the federally funded program, offers free testing and evaluation and services for children who can be diagnosed with autism and can begin receiving behavior therapy before the age of 3. After the age of 3, that program goes away. So there's a time limit. So if you wait until after your child is 3 to get started, now you have to go through finding a neurologist, a psychologist, a developmental pediatrician with a longer waiting list time to be able to see and diagnose your child in order to access those same behavior therapy services, ABA services, and to give them the appropriate accommodations that they need to succeed in school. A child with autism cannot always learn in the same environments that neurotypical children use to learn. This world was designed to teach neurotypical children. Special education classrooms, in and of themselves, are not automatically designed to teach a child with autism. children with autism have unique and special needs from an educational standpoint in terms of smaller classroom sizes. And in some cases, depending on what their unique challenges are, they need an educational approach that's based in ABA, methodology as well.
What's
So,
ABA, Doc?
so ABA stands for Applied Behavioral Analysis. Out of all of the tried and tested methodologies for helping a child build social skills, communication skills, control their impulsive behaviors, only ABA has stood the test of time, be proven and effective to help children make progress. Not any other snake oil supplement, blah, yada, yada, sale nonsense out there on the streets. ABA is the one and only that has gone through the test of time, has undergone research, and has been proven beneficial to help a child find their voice where before they may have been without one completely.
Awesome. And I'm writing that, for those of you, please take note. This is very important to know so you can also advocate for your child. I love that there are resources available. I love the emphasis on making sure your child is in an environment that is neurodivergent friendly and accommodating, and the teachers are skilled. So it has to be in an environment where is catered for their type of learning. So that leads me to my next question. How do you encourage parents? Or what are tips, strategies for parents to raise children on the autism spectrum? Any tips?
Absolutely. The first and a major tip that I give to all families is that we have to change the lens at which we look at what we expected and anticipated for our child before we had our child on the autism spectrum. So the definition of success in life changes. And that doesn't mean that we all of a sudden don't expect as much of our children. Not at all. Now we look at celebrating each individual win because of just how much energy and effort it took that child to accomplish the same milestones that a neurotypical child may not have to go through as much work and struggle to accomplish those same. So celebrating small wins is a major, major parenting hack. Making sure that we let our children know that we see exactly how much effort and work they're putting into attaining skills and making progress. Patience. Being patient with a child on the autism spectrum is more important than ever, because where a neurotypical child can learn by just watching what parents do, a child on the autism spectrum needs those same things that could be otherwise observed to be broken down for them so they can understand step by step of how things happen. And make transitions smooth and easy for kids. Give them a heads up. If you can imagine as an adult, if you're on your phone scrolling through that wonderful Instagram, just checking out, seeing what latest fashions are, what have you, and someone just runs up to you and snatches that phone out your hand, you will get pretty mad because you were right in the middle of doing something and someone just janked it. That's exactly how it feels when a child with autism is told, okay, now it's bedtime and now it's bath time. We have to stop playing the game. We have to go. They need a timer. They need a heads up. They need to know that within this period of time, we're going to go from this activity to this one. So cushion those transitions. Don't just jump from A to Z. Go through a little B, C, and D for them. It may take a little longer, but here is where the patience power comes into play. And even if you don't see the progress or results that you want to see as a parent in the short term, always keep in mind that by maintaining your calm, by being patient over the long term, you look back on the goals that you were working on in the past and the goals and what you're working on with your child now, you'll see just how much progress and improvement they have made. And that should fuel both of you, your child and yourself, to continue to make improvements and progress going forward.
Wow. Thank you for sharing that. Now, are there any resources that you recommend? Because there's a lot to cover, even advocating for themselves before the insurance companies, advocating for themselves in schools, medical settings. Um, I there was I think we were at an office, with an immigration office, and there was a child, and I could tell that, she was autistic, and the mom was so flustered, almost like looking around and trying to make sure that no one would, um, because her child, her daughter, was having an outburst, and you could tell she was embarrassed. And any tips for parents, because it's not easy,
Of course.
we don't have a neurodivergent community that's everywhere, that circles us everywhere. So sometimes you're caught in. Any tips for parents navigating this as a, oh, I don't even know how to say it. Any words of encouragement for the challenges that come with having a neurodivergent child?
Yes, the world was not, as you said, designed for a neurodivergent child, to raise a neurodivergent child, but you are not alone. Other parents have gone through the same journey, are continuing to do so. And Dr. Vlad has an amazing YouTube channel devoted to parents and parenting children with autism, answering all kinds of common questions that he hears in lovely, digestible 3 to 5 minute segments
I love
that they're pre-digested for you. They're easy to, they go right through you, nice and easy. I try not to be boring on there. I try to keep it light and friendly.
You're never boring, sir. I don't think it's possible, Dr. Vlad. No. Sorry.
I appreciate that. Likewise, you are never boring. I can never not smile when I'm talking to you and all of your greatness and glory. Amen. So know that you're not alone. That's the first thing, parents. And children that cannot speak, or even those that can speak with autism, don't always let us know verbally how they're feeling. But the one language that's universal to all kids with autism is their behavior. They can let you know how they're feeling through the way that they're acting. And if you understand, and if you arm yourself with the what ABA methodologies can help you as a parent, because it doesn't only apply to your child. You can learn ABA methodologies yourself from a licensed practitioner, a BCBA, to get some parent training. You'll understand, oh, my child is acting this way because, and therefore the next time we go out, we can avoid the situation by doing this, or we can slowly transition our child by having this meltdown by doing this. You will feel more empowered. That it gets better as they get older, that you get armed with more skill, more resources, more perspective. And never forget that autism is not only a challenge in some cases, it is also a gift and a blessing, because that child notices things that others around them may not. That child has ideas, thoughts, wishes, and dreams that other people do not. And our world would be different if we did not have people with autism in the community contributing to our world and helping to enrich the tapestry of our life and our community.
I love it. Autism is a gift and also a blessing. Now, I have one more question. We're about done, but someone asked a very good question. And hi,
You ask
Valerie.
amazing questions, by the way.
Thank you. But this is a very good question. She says, how do you handle suggesting to a parent to have their child diagnosed for possible autism, especially when they associate autism with stigma? So you see the signs, you see a parent. Any tips for that person to yeah.
Absolutely. Yes. So I tell families this: getting the evaluation and getting the diagnosis can only be helpful to your child. Why? Because if they are in need of services and they don't get those services early on, the benefit that they get from the services is much less later on. The problem will not go away. Autism just doesn't disappear. You don't wish it away. This is part of the identity of a child. And if your child is having struggles and you are noticing the classic signs and symptoms of autism in your child, by not getting them evaluated, by not knowing that this is the underlying cause of their challenges, because behavior problems happen not only in children with autism. They can happen with other children who are neurodiverse, or they can happen with neurotypical children. This is where the eye of an expert helps you know what the boundaries are and whether this is something that is falls into the autism spectrum or not. Because some of the times kids who have ADHD can also have symptoms that can look similar to autism. They can avoid eye contact as well for children who have ADHD because their minds may be racing most of the time, but they don't have all of the full diagnostic criteria of a child with autism. So your job as a parent is to see your child happy and healthy. And the best way to do that is to make sure that if there are concerns, if there are delays that they are having, you as a parent, it is incumbent upon us to know where these delays could be coming from to help our child in the best ways. Otherwise, what will end up happening is you have a child, and I've seen this happen many times. You have a child who you're concerned about with their speech. They're getting speech therapy. They're getting occupational therapy. They're not getting much better. They're making this much progress, barely. But the moment that they start ABA therapy, boom, they're like making that much progress all of a sudden. So you don't want to rob your child of the possibility of having all that progress. The stigma is real. I 100% understand it. And nobody is telling you that if your child is diagnosed with autism, you have to go and announce it to the whole world. My child has autism. It is a very personal decision that you make for yourself and as a family, who you want to let know about this or not. But in the meanwhile, the child is getting the services and help that they need to help them make progress. And we don't know what their potential could be. Your child could be the next Albert Einstein. For all we know, they are so young and small at the age of 2 and 3. We don't know. Temple Grandin was nonverbal until the age of 4. Not a single word out of her mouth. She is a PhD researcher now with multiple awards that she has won. We do not know the full extent and potential of our children. The worst thing we can do as parents is not give them the opportunity to live their full potential, right? To get in their way, to say, oh, you're limited by my limiting beliefs on you. So I want to encourage parents, no limiting beliefs on our kids, unleash them, unleash all their potential, let them have the support and help that they need to thrive and to flourish, because it's all about thriving at the end of the day.
I love it. You're reminding me to think 5 steps ahead. The encouragement here is play the long game. At the end, we want our children to do well, to thrive. So if it's going to take having them get the ABA therapy, regardless of what people say, in the end, our child is better for it, so it's worth it. Thank you for this powerful reminder. I believe all our parents who are watching, they want what's best for their children. Sometimes it's also trying to protect their interests that we shy away from doing the needful. But you've given us a powerful reminder as to why we need to do that. Get the intervention early. Get the testing. You said over testing is not the issue. It's under testing. That's the dangerous part. Phew, this was good. And we already passed time.
Yeah.
This is good. This is good. That's so funny. My daughter's commented. She said, keep your child's autism a secret. Keep it confidential, please. That's necessary.
Oh my goodness.
Oh my God. This was so good, Doc. Thank you so much for coming. We're going to do this again. I'm going to put you on the spot and ask that we do this again, maybe first quarter next year. Mm-hmm.
Done. I'm there.
Okay, we're live. So
I'm there.
And then
sign me up.
And you should see the comments. People appreciate you. They're saying, thank you for doing this. This was good. But Doc, could you, before we go, people are saying you talked about a YouTube channel. I've already put it here, what I believe it is, but could you tell people how can they find you, to watch you, to connect with you, and possibly, if they're your neck of the woods, have you be their doc?
Families, have no fear. Navigate autism with confidence. Dr. Vlad is here to support you in any way that I can. So I have a YouTube channel, which the link is so graciously provided by our lovely host. I also have a website for my clinic. I practice in New York City. I see patients here on Staten Island in particular. So any family, honestly, living in New York State can contact my office to get a free consultation about how I may be able to help support their child's autism journey. And I'd be more than happy to. I'm continuing to make more YouTube videos on a weekly basis. We're up to week 52 nonstop. We haven't missed a week of publishing videos out there. And there's a lot of information that keeps coming out on a daily basis, because our knowledge and understanding of autism is, the book has not been completed yet. We are still learning new things and more things on the horizon, exciting things and new therapies on the horizon. and new approaches to looking at autism and differentiating autism from profound autism. All these things are coming on the horizon. So if you want to stay up to date on the latest trends and information and on what's going on, please follow me on social media channels, Instagram, Facebook, YouTube, my website. Send us an email, ask your questions. Don't be shy. Raise your hand. Only good things will happen.
That's I like that. Only good things will happen. So it's www.thebdpc.com. All right. It's right there at the bottom. He's also on Facebook. He's on Instagram. He's on YouTube as well. You know, I'm not big on the, you know, being on social media for too long, but there's binge-worthy content, and his is. All right. These are tools that will empower you, empower your child, empower your community. As always, please share, because sharing is caring. You know someone who used this video, send this to them. You never know whose life you would change and how you change the world in the process. Dr. Vlad, I appreciate you. Give me a high 10. High 10.
High 10.
Ooh, all right. Awesome. And thank you all for watching. We had pretty good engagement here. I appreciate you all for watching, spending your Tuesday evening with us. God bless you. Have a good one. I'll see you in our next live. And as always, if you're looking for an awesome, a thorough, and a compassionate family physician that will have conversations like this to help you live long and well, I am she. Have a good one, everyone. Thank you. Thank you again, Doc. You rock.
Thank you. Namaste.